Casodex tablet is used to treat prostate cancer. This medication works by blocking the action of male hormones in the prostate, slowing the growth of cancer cells. This medication should not be used in women and children. Generic name bicalutamide. Indications. Casodex is used to treat prostate cancer that has spread to other parts of the body, metastatic. How to use. Take Casodex exactly as prescribed by a doctor. Follow directions on your prescription label and read all medication guides or instruction sheets. Your doctor may occasionally change your dose. Casodex is usually taken once per day in the morning or evening. Take this medicine at the same time each day, with or without food. Usual dose for prostate cancer, in combination with an LHRH analog, 50 mg orally once a day, morning or evening. Contraindications. You should not use Casodex if you are allergic to bicalutamide. To make sure Casodex is safe for you, tell doctor if you have liver disease or diabetes. Warnings. Casodex is used to treat prostate cancer. This medicine should never be taken by a woman or child. Bicalutamide can harm an unborn baby if you father a child while using this medicine. Use effective birth control to prevent pregnancy while using Casodex and for at least 120 days, about 90 weeks after your last dose. Casodex can harm your liver. Call a doctor at once if you have nausea, upper stomach pain, itching, loss of appetite, dark urine, clear-colored stools, or jaundice, yellowing of the skin or eyes. If a driving or has this activity until now has this medicine will affect you. Your actions can be impaired. Casodex side effects. Get emergency medical help if you have signs of an allergic reaction to Casodex, hives, difficult breathing, swelling of your face, lips, tongue, or throat. Call a doctor at once if you have breast pain or swelling, sudden chest pain, wheezing, dry cough, feeling short of breath, low red blood cells, anemia, pale skin, unusual tiredness, feeling lightheaded or short of breath, cold hands and feet, liver problems, nausea, upper stomach pain, feeling tired, loss of appetite, dark urine, clear-colored stools, jaundice, yellowing of the skin or eyes, fever, chills, high blood sugar, increased thirst, increased urination, dry mouth, dirty breath odor, or if you are also take warfarin, unusual bruising or bleeding. Common Casodex side effects may include anemia, blood in your urine, fever, chills, flu-like symptoms, trouble breathing, hot flashes, pain in your back, pelvis or stomach, swelling in the arms, ankles, legs or feet, increased nighttime urination, weakness, dizziness or nausea, diarrhea, constipation.